Hello, class. Welcome to the unit on diabetes. Diabetes is a major health concern in the United States and throughout the world. In this unit, we will focus primarily on the effects of the United States. As you can see, I've listed some of the different statistics from the American Diabetes Association. Some of the other statistics are that in 2012, more than $245 billion in health resources were spent, along with lost productivity. People with diabetes have 2.3 greater health care costs than those without diabetes, so obviously it is of major concern. There are 4 types of diabetes. Gestational, when blood sugar is high during pregnancy, which can lead to being pre-diabetic. Prediabetes, which is when blood sugar is elevated but not enough to be a type 2 diabetic. Type 2 diabetes is when the pancreas produces insulin, but not enough is produced or the insulin is not used effectively. Some causes that lead to type 2 diabetes are obesity, genetics, and metabolic syndrome. There are some things that are not able to be controlled by an individual, such as family history, age, and ethnicity. Things that can be controlled, though, is exercise, smoking, stress, poor eating habits, and too little or too much sleep. There are some health-related concerns that can lead one to having type 2 diabetes, such as gestational diabetes, being overweight, high blood pressure, high triglycerides, low HDL, which is the good cholesterol, and polycystic ovary syndrome. Type 1 diabetes is when the body produces no insulin. The body's immune system destroys the insulin-producing cells, which are called beta cells, in the pancreas. Diabetes affects many parts of the body. As you can see by my graphic, the brain is affected. There's blood vessel damage, which can lead to vascular dementia. There's blood vessel damage also to the eyes, which leads to diabetic retinopathy, which can lead to blindness. There's nerve damage that causes diabetic neuropathy. That's often seen in the feet and legs with pain and numbness, but can be seen in the hands and the arms. Damage to the heart, blood vessels also leads to heart disease or stroke. Type 2 diabetics often have one of the following conditions that increase their risk of heart disease: hypertension, abnormal cholesterol levels, obesity, and or smoking. Kidneys can also be damaged, uh, again related to the blood vessels, which clean the blood. And when those blood vessels are damaged, they're not able to clean and filter the blood properly. The body also will retain water and sodium. Increased protein will be found in the urine, and waste products will build up in the blood, all leading to the potential for the need for dialysis. 30% of type 1 patients will develop kidney disease, and 10 to 40% of type 2 will develop kidney disease. There is treatments. Let me move down to that. Type 1 diabetics will always require insulin. With type 2, lifestyle changes are the first line of defense, starting with diet and exercise. If lifestyle changes are not effective, then medication is started, such as metformin. That's usually that first drug of choice. If one medication isn't enough, then individuals will be placed on possibly 2 or 3 medications until an effective treatment is obtained. When working on obtaining an effective treatment, usually there is adjustment every 3 months. A goal will be set, and in 3 months, if the goal is not obtained, then there's an increase in therapy or a change in medications. Some of the different types of medications that can be added are SGLT2 inhibitors, which decrease the reabsorption of glucose in the kidneys. Farxiga and Invokana are two types of these drugs. GLP-1 agonists are medication that mimic the incretin hormone in the body, which decreases post-meal blood glucose levels. Trulicity, Bydureon, and Victoza are some of these drugs. These drugs are injectable, which sometimes some of the patients are not real happy about having to do an injectable, but they can be done once a week if needed. DPP-4 slows the activation and degradation of GLP-1, ultimately improving blood glucose control. Januvia is a DPP-4 medication. AGI is alpha glucosidase inhibitor, which delays the absorption of carbohydrates. Glycet and Precoce are a couple names of that type of drug. When these medications do not work, patients need to go on insulin therapy. People need to take care of their diabetes. They need to monitor their glucose at least daily, if not more often. They should have regular dental checkups to avoid gum disease, regular doctor visits every 3 months when managed on when working on managing their treatment program, and maybe every 6 months when they're well controlled. They'll also monitor for complications of diabetes such as hypertension, abnormal cholesterol, and infection. Should have routine eye exams and a podiatrist checkup at least annually, just to keep toenails trimmed and avoid infections in the feet. I look forward to working more on the diabetes with you and hope you will be as excited as I am in this unit.